are all going to have to be covered.
So
So,
this year, in addition to the general things, like a lot of, because at one point dental wasn't covered, right? So dental is now covered under a lot of these plans as well now, right?
so
Because
pediatric dental is required to be covered. And then
pediatric,
many
okay.
carriers offer a buy-up of dental where if you want to add dental benefits, you can add that as well. So there's the potential in the future that adult dental could become an essential benefit, but it is
Okay.
not today. It is not today. Pediatric dental is though.
And the same with goes with vision. I think you're allowed to add on vision insurance as well.
Correct. You are correct. So that is considered an essential benefit for kids.
Hmm.
And then, so it's up to age 19 for dental and vision. And then for adults, they would have to add coverage for that if they were interested in adding vision or dental coverage typically. Some plans, you could see plans that potentially build that in, but that is not considered an essential benefit today.
Hmm. So can you tell us a little bit about the different types of insurance? Because again, when Emrys went onto the marketplace, and I actually, literally, I was in my other office. I was in my office, and she was on the other side trying to figure all of this out. And she was
Yes,
actually really nervous because it was the first deadline, which was in December 15th. That
yes,
deadline,
for January 1st.
it was on December the 4th that she was in there. She was kind of like, "Oh my God, I'm missing this deadline."
Well,
And
you
she,
are ahead of a lot of people because most people are doing it on December 15th. So I give you
so,
credit
so she,
for being
so she,
ahead.
so she thought she was going to miss the deadline, but she just happened to be in the office with me. So I'm like, sit here and do it right here while
Yeah.
I'm around so
It,
Mhm.
I can help you answer questions.
Yes.
When she did that, she's in there and she doesn't know, like, what did she buy? So when you talk about HMOs, PPOs, the different types of insurance, I went back over it with her to try to help her understand what it was she was purchasing. But the reality is, and I relearned that night, was a lot of people don't know what any of this stuff is.
Yes.
What's
Yes.
a
Because
HMO?
it is very confusing. Like looking all and like all the little acronyms, and I'm like, what's this? And they do have like you can online click them, and they'll give you a little description, but even the description is like, okay, but I still don't understand.
What does that actually mean to me? So I think the easiest way that I have found to explain things in Independence offers three different types of plans to individual consumers. So the first is what we call a PPO plan, a preferred provider organization. And with a PPO plan, uh, there's going to be a network. So with any health insurance, there's going to be a network of providers, and that's who the health insurance company has contracted with: doctors, hospitals, um, physical therapists, you name it, the type of healthcare provider, they're being contracted by the health insurance company. And with it, you're typically going to have in-network benefits. And then the question is whether the plan covers out-of-network benefits or not. So in-network is anybody that the plan has contracted with, the health insurer has contracted with. So with a PPO plan, you actually have access to in-network and out-of-network doctors. So you're going to pay a lot less when you use in-network doctors. But if you have the need to go to an out-of-network provider, you have the ability to do that. There will just typically be a higher deductible for that and higher out-of-pocket cost sharing after that deductible is paid. So it's more expensive for you. The beauty of an Independence Blue Cross PPO plan is that we have something called Blue Card PPO, which means that you have access to any participating PPO provider with any Blue Cross Blue Shield plan across the country. So you'll get those in-network benefits as long as they participate with a Blue Cross Blue Shield plan across the country. The other thing with a PPO that is unique is that, or different from other plans, is with the PPO plan, you don't need to select a primary care physician. Some plans require you to do that. And you also don't need referrals. So people like the freedom of a PPO plan. It allows a consumer to look at that and say, hey, these are the doctors I want to go to. Some are in network, maybe somebody they go to is out of network. And then also have the ability to just pick that doctor, make an appointment, and go. When we look at the next type of plan, which is an EPO, which is an exclusive provider organization. With that, it's similar to a PPO, but there are no out-of-network benefits. So with that EPO, there's no primary care physician, there's no need for a referral, but you're only covered for in-network services. You wouldn't be covered for out-of-network. Now, I will say there is one distinct with every plan. If somebody has an emergency, you are covered for out-of-network benefits, because obviously if it's an emergency situation, you need to go to the nearest hospital, right? So whether that's in the network or out of the network, health insurance carriers have to provide coverage for emergency care. So, but typically with an EPO plan, other than emergency care, you need to go to in-network providers. And again, you can select those yourselves, make an appointment and go. The third type of plan, yes, go ahead.
I was going to say, so that goes with a lower deductible, I'd assume, or a higher.
So we'll get to that in a second. If we can hold that one question, I'm going to share another thing that the federal government did to help consumers understand how they're going to pay, how much they're going to pay out of pocket. So just real quick with HMOs, just to show the distinction of plans. With an HMO plan, and that's a health maintenance organization, that's the plan that where you're going to be required to have a primary care physician to help coordinate your care. You're going to need to have referrals. There's a lot of value in that. You know, a lot of people, as you don't know what to do about health insurance and how health insurance work, people also don't understand sometimes what type of specialist do I need for the symptoms that I'm having, right? And that's where a primary care physician can really help guide a patient and to understand, you know, this is something I, as a primary care physician, I'm not a primary, but pretending I was a primary care, this is what I could help you with, right? But hey, you need X, Y, and Z. You have a broken bone. We need to get you to an orthopedic doctor, right? Or something like that, right? That's where a primary care physician can help guide members as to where to go. And then that's where they use those referrals to say, hey, we've had this appointment. I really think you need to see a specialist. You know, here's where in that conversation with the patient, the best place for you to go for that next step. And then they can give them that referral to that next step. So that's where so you kind of have that PPO, which is that total freedom, in or out of network, no referrals, no primary care physician, or what we like to call PCP. Then you have an EPO that kind of sits between the HMO and the PPO, where you still have that freedom to go to any in-network doctor or hospital of your choice without a referral, no need for a primary care physician, but no out-of-network benefits. And then you have the HMO, where it's in-network benefits, but you also have that extra of that primary care physician that you select to help kind of guide you through health insurance. Now, with your question about how much you're going to pay out of pocket, you know, one of the things that we think is really important for consumers to think about is that they really not just pick a plan based on how much it's going to cost them on a monthly basis, you know, what they call that premium. That's how much you get billed by your insurance company every month to have insurance. But we want to make sure that consumers also can afford to use their plan, because even though you're paying a monthly premium, when you need services, when you go to the doctor, the hospital, get a prescription filled, there is what they call cost sharing. And the cost sharing can be in the form of a deductible, which is an amount you have to pay upfront before insurance starts to pay. The other things that are out there as far as cost sharing are copays. So copay is a set dollar amount. And then the third thing is coinsurance, which coinsurance is a percentage of the provider's cost, so whether it be a doctor or a hospital, so a percentage of the cost of the service that you're having done. So with understanding a little bit of some of that, what the government put in place with the Affordable Care plans is that there are metallic tiers. So all the plans that are offered by health insurance carriers, they have been evaluated to understand for the plan that's there and the cost sharing of that plan, so how much the consumer has to pay, they are assigned a metallic level. So it's platinum, gold, silver, and bronze. So with a platinum level plan, that means 90% of the cost is paid by the health insurer, and roughly 10% of the cost is paid by the actual consumer. With a gold level plan, then it is 80% of the cost is covered by the health insurance plan, 20% is covered by the consumer. Silver is 70% is covered by the health insurer, 30% is covered by the individual. And then the last one is bronze, which is 60-40. So those metallic tiers help you understand on average how much is going to be paid by the health insurer and how much is going to be paid by you. And then when you're looking at that, yes.
So who's in the tier, the company or the individual?
So the tier is the company, and the company often offers multiple plans. So they're going to have.
Yes, I'm like, wait a minute, who's in the tier? Is it because it's based on the individual's ability or this is what the company? So if you're like a gold company, like that means
so it's the company is going to offer options for people to select, and they could be in multiple tiers.
Okay.
They could have 5 plans that are gold plans, 5 plans that are silver plans, 3 plans that are bronze plans. So they're going to offer coverage at different metallic tiers so that people have options for them, right? Some people may prefer to have those copays, those set dollar amounts, so that they know, all right, for my budgeting, I know I'm going to pay this amount for my premiums every month. And then I know when I need to go to the doctor, it's going to be $25 every time I go. If I get hospitalized, it's, $150 per day that I'm in the hospital, up to a maximum number of, X dollars, right? Whereas other people say, hey, and those plans are typically more expensive. Those are going to be your gold. So typically because if the insurance carrier is paying the bulk of the cost, 80% of those costs, it's going to be a costlier monthly premium for members because you're going to be paying a lower amount of the services that you need, right? So it's kind of that trade-off. So typically what you're going to see, the higher the premium, the lower the out-of-pocket cost is for the member each time they need care. The lower the premium, the higher the out-of-pocket cost is for the member, right? So that's where you get. So when you get to that bronze plan where it's 60% paid by the carrier and 40% that's paid by the individual themselves, that's where you're typically going to see higher deductibles, right? So that amount that you're going to have to pay up front before health insurance really starts to pay.
No. So you just really this is why, do you guys have people who actually can lead people and help them make these decisions? Because
yes,
this is overwhelming.
Yes,
and it Amherst now has like 20 more questions, and she already heard this insurance.
Yes,
but if you can see her face.
I'm very readable.
We do have licensed agents that are available and can talk people through this. And it's important to have these conversations with a licensed agent, because the other piece too, not only will they help you understand how all these products work, help you, find a plan that's going to fit your needs and your budget, but they'll also help you understand if you qualify for a subsidy. So one of the things that we have not talked about today is that the federal government does offer tax credits or subsidies to help people afford health insurance. And they come in 2 forms. So one is a subsidy or a tax credit that helps with your monthly premium. So depending upon your income and the number of people in your family, that will determine how much subsidy that you are eligible for. And that will help lower that monthly premium, what you pay each month to the health insurance company. People who are have lower incomes, or have several, that income plus the number of people on their plan, actually may also qualify for a second subsidy or tax credit, which actually can help reduce what you pay out of pocket. So there are 2 types of subsidies, and depending again on your income and the number of people in your family that are being covered under that policy, that are eligible under that policy, that could reduce your monthly premiums. And some people, in addition to monthly premium reductions, can also get that out-of-pocket cost, those deductibles, those co-pays, that coinsurance lowered based on their income as well. If somebody qualifies for those subsidies to lower their out-of-pocket costs, they need to pick a plan on this, what they call the silver tier. So a silver plan, which is the plan that covers typically 70% by the insurance company, 30% by the member. But when you get those additional subsidies, the federal government is helping to subsidize some of that 30% for you. Okay. Yep. So wow. if you only qualify for the premium tax credit, that can be applied to any of those metallic tiers, platinum all the way down to bronze. So you can really choose to apply that. Your money will go further in covering more of your plan if you were to pick a bronze or a silver plan, but you can still, if you still, again, with your budget, you feel more comfortable selecting with what your medical needs are, picking a gold or a platinum, you're able to do that. So and then to get back to your question too, Independence Blue Cross does offer agents, licensed agents that are available. The phone number to reach one of our licensed agents is 1 855-215-2150. And again, I'll give you that number. It's 855-215-2150. And they'll be available to offer help with people.
From now until the end of the day tomorrow.
Yes. So now and through tomorrow, agents are available to help. The other resource that I will give to people, especially if they believe that they're going to be eligible for one of those subsidies or tax credits, is penny.com. So if someone is eligible for a tax credit, or to help with offsetting premiums and or their out-of-pocket expenses, they need to apply through Penny. A licensed agent can help somebody apply through Penny, or somebody can go directly to penny.com. And again, I'll spell that for you. Just it's pennie.com, so that people can go and, again, look at their plans, see what's available to them. But an agent is super helpful to walk through things for people, to just give you the confidence that you are picking the plan that is right for you. There are also brokers that are available to help consumers as well.
So what would you say to the person who starts the process tomorrow at 7 o'clock, and they have a situation that is somewhat comprehensive and they can't just get their insurance, but they start the process? Will they still be given a chance to finish, say, Monday morning if the process is started? I'm just asking because I know that there are people probably like myself who will be like last minute, and then it's like, it's not going. You know, like the people who wait until 11:59 to file their taxes.
We are procrastinators. We are definitely like that. That is
what happens when you have a million questions, but you went in, you started your application. It shows that it was 11:30 that you did this, and you get stopped. Does that mean that you can't do it? And we're running out of time, but I really want to do this and also give you another chance to share that number.
Yes. So I will say this. I will say, one, if you start at 7 o'clock, you should be able to get that application in and get the coverage that you need. If there's a big, onslaught of people that are trying to get through to penny.com or to get through, at the last minute, Penny has at times extended the deadline. So, if people are looking to get covered, we are here to help people. Again, that phone number is 1-855-215-2150. I really encourage people to start today to make sure, because there is no guarantee that deadline will be extended, because Penny has technically already extended the deadline because it was supposed to be on Monday. But because of the holiday, they allowed a few extra days for people. So I really encourage people to start today. Call one of our agents today at 1-855-215-2150, or visit penny.com, or we have our website as well. You can go to our website, which is IBX.com. On IBX.com, we do have a subsidy calculator that can help you understand if you're eligible for a subsidy. And then you can go from there to either make that phone call or to go online, and feel comfortable to ask the questions that you need to ask, get the information you need to enroll.
So, Koleen, I want to thank you for coming on today to share this information with our listeners. Again, time goes really quick when you're having fun. We usually have a good time on the show. We do share a lot of information, but we actually do laugh a little and try to have a conversation versus just a whole bunch of information. So people who are listening, deadline tomorrow. There are articles on Scoop, and we'll share them out from Penny and from Independence Blue Cross, so that there's more information available at your fingertips, and then you can kind of do like people do now and click buttons and actually go to websites and learn what you can do. Thank you so much again for coming on, Koleen. I hope that you'll come back throughout the year so that we're not doing it at the last minute. All right?
Thank you so much. I appreciate you having me, and I'd be happy to come back again. Thank you so much.
Thank you.
Thank you.
Take care. Bye-bye.